How is leptomeningeal disease treated then? We know how it's diagnosed. How do you manage this disease in patients?
Yeah, and I laugh only because this is another "it depends" answer. Um, but there are multiple modalities that can be used to treat leptomeningeal disease. Historically, the primary modality has been radiation-based. Um, if you think about leptomeningeal disease, again, going back to that very first question, anatomically is something that surrounds the brain and spinal cord. You can imagine that some of our fields for radiation can be quite large. And so we often do radiation if we need to palliate symptoms, if we need to make symptoms better quickly. I like to lean on radiation for that primarily. Other modalities that we might utilize either instead of or after could be things like intrathecal therapy. And this might be something I'm not sure if the listeners are familiar with it, but essentially with intrathecal therapy, there are two ways to administer it. You can either do it via a lumbar puncture where you're in that fluid space and then you can inject chemotherapies. And more commonly, what we use is basically a port that we surgically place, similar to like a port that you would have chemotherapy go into your bloodstream. This is a port that communicates directly with your ventricular system or that CSF fluid system, where we're able to directly administer drugs to the CSF. So we've talked about radiation, intrathecal therapy, and a third modality is systemic therapy. So that's just chemotherapy that or medical therapy, directed therapy that can be orally administered, it can be orally given, can be given via IV. So in different manners, just like traditional chemotherapy that you think of for breast cancer.
Got it. And I just wanted to mention the intrathecal delivery when you were talking about that port. That's called an Ommaya port. Is that correct?
Correct. Yeah.
Okay, I just wanted to make sure I had that right. I'm curious, I'm just for myself, how often do you use whole brain radiation? I think again, you're going to tell me it depends on where the lepto is located, because I know I've definitely seen patients get radiation to the spine because they're having trouble walking. But do you use whole brain radiation often?
We do. And I can't quote you a number because it's kind of different site to site, patient to patient, and in terms of across the board, across the world or the country, I couldn't tell you a percentage, but absolutely we do. We use whole brain radiation. We might use skull base radiation where a lot of those cranial nerves are. Leptomeningeal disease can look very different from patient to patient. It could have more bulky or nodular disease, or it could be diffuse and quite thin. And those are situations and various factors that we use in mind to decide treatment. So I think what I might sort of mold this question into is what are the different factors that influence what we decide to do for our lepto patients. So that includes things like the symptomatology of patients. So what are the symptoms that specific patient has? And is the treatment that we give going to alleviate or help those symptoms? It really is going to depend also on what's happening throughout the rest of the body, because we might be able to come up with a treatment regimen that can ideally kill two birds with one stone that addresses the systemic disease and the brain disease. Proximity to when radiation is very important in deciding intrathecal therapy or what kind of chemos we might use. And the functional status of a patient, how well a patient's doing, how are they functioning day to day, and what sorts of treatments can they endure. So there are a lot of different factors that go into that "it depends" answer.
Yeah. And it sounds like so you can actually use a combination of some of these different treatments as well. Is that right?
Yeah, absolutely.